In this video, we are going to cover the basics of coordinated entry, including its purpose and key components. So what is coordinated entry? Coordinated entry is a process through which people at risk of or experiencing homelessness can access resources in the housing crisis response system in a streamlined way, have their strengths and needs quickly assessed using a standardized assessment tool and practices, are referred to appropriate housing and mainstream services tailored to their needs, while the most intensive interventions are prioritized for those with the highest needs. The four key components in a coordinated entry system are access, assessment, referral, and prioritization. Coordinated entry is a way of structuring a continuum of care systems of care so that it fits together intentionally and efficiently. This will result in more efficient use of resources, improving fairness and ease of access to resources, including mainstream resources, and prioritizing people who are most in need of assistance. Coordinated entry changes a COC from a project-focused system to a person-centric system. To create this shift, we use a systems change approach. Without coordinated entry, we ask, does this household fit into our program? When the focus is on programs, we often have unique assessment processes at each organization and only partial knowledge of community resources due to a lack of communication across agencies or sectors. With coordinated entry, we ask, what housing and/or services will quickly and permanently end this household's homelessness? With a client-centered approach, the community uses standard assessment processes and forms that will benefit the client and benefit community collaboration. Information about available services and housing interventions is more accessible, and different agencies and sectors are coordinating and collaborating based on the strengths of their programs and services. Let's go back to the four key components I mentioned on the first slide. The first is access. Access refers to how people experiencing a housing crisis learn that coordinated entry exists and how they access crisis response services. Access points engage people in order to address their most immediate needs through referrals to emergency services, as well as determining which intervention might be most appropriate to connect those people to housing. The purpose of designating access is to ensure that all people in a community have equal access to all crisis response system resources. Assessment is the process of gathering information about a person entering the crisis response system. It includes documenting information about the housing barriers the person faces and any characteristics that might make them more vulnerable while homeless. With coordinated entry, the assessment should collect information to identify a person's immediate needs, long-term needs, and preferences in order to connect them to appropriate interventions. Referrals are how we connect people to resources that meet their immediate needs, as well as housing projects and supportive services. Referrals involve screening for eligibility in order to match a person to housing that they are likely qualified for. The community must come together to form a participating project list in order to know and understand all the resources available in the community. Prioritization is the process by which all persons in need of assistance who use coordinated entry are ranked in order of priority. The purpose is to ensure that persons with the highest priority of need are offered housing and supportive services first. The person's level of vulnerability or needs is determined by analyzing the information obtained from the assessment against the COC's prioritization standards. In the Texas Balance of State Continuum of Care, we have 17 regions, each with their own local coordinated entry process. Although each region manages and operates its own coordinated entry process, They all follow the written standards of the Texas Balance of State Continuum of Care. The reason we have coordinated entry regions is because the process can vary based on the community's context. Our geographic coverage is so large that we rely on these regions to support the day-to-day operation of coordinated entry at a local level. If you'd like to learn more about coordinated entry or have any questions, you can email THN at ce@thn.org.